As a clinical negligence solicitor, I see many cases arising out of misdiagnosis, and the consequences can be very serious, if not fatal. Some common examples of such cases are the misdiagnosis of fractures, whereby medical professionals often interpret x-rays incorrectly or fail to take an x-ray at all. This often leads to the need for avoidable surgery, and the fracture may not heal as well as it would have done with earlier treatment. Misdiagnosis of cancer is another common example. Often GPs fail to recognise the common signs and symptoms, resulting in an incorrect diagnosis. Where there has been a failure to diagnose cancer, the worst case scenario is sadly the loss of life or reduction in life expectancy. Misdiagnosis of bleeding is another example. This is often overlooked after surgery. Symptoms are usually missed altogether or attributed to unrelated conditions. This often results in an additional surgery or even blood transfusion in some serious cases. Misdiagnosis of infection, an example being the failure to diagnose meningitis, often seen in cases involving children. This can be due to a failure to recognise the symptoms, failure to perform appropriate investigations, and a failure to commence antibiotics. The consequence can often be devastating for the child and the family and may result in a brain injury. Misdiagnosis of cauda equina or spinal cord compression are often seen. These are medical emergencies, but sadly the symptoms are usually overlooked or attributed to general back pain or something else completely. If surgery is not carried out promptly, the patient is often left paralysed and needing lifelong care. If there has been a claim relating to misdiagnosis, additional treatment may be required along with care and assistance. The cost of these losses, both past and future, can be claimed to compensate the injured person. In some cases, there may have been an ability to return to work for a period of time, or the person may be unable to return to work indefinitely. In those cases, a loss of earnings claim can be pursued to compensate the injured party for the past losses and the future losses. In some cases, the injury may be so severe that a person is unable to live independently. Care packages can be claimed in such circumstances, and often new accommodation is required to house not only the injured person but also the care team as well. Various therapies are sometimes required, such as physiotherapy and speech and language therapy, and these can be claimed on a private paying basis. In cases where there's been a loss of life, funeral expenses can be claimed. The court may also award a sum of money to compensate the family for the loss of life. In cases involving misdiagnosis, not only must we show that the medical professional failed to make the correct diagnosis, but we must also show that it resulted in a worse outcome for the client. So even if there has been a clear misdiagnosis, if the treatment and outcome would have been the same in any event, there would not be a claim to pursue. This is often the most difficult part of any clinical negligence claim. Stevensons are experts in the field of clinical negligence, and if you feel that you may have suffered medical negligence due to misdiagnosis, feel free to give us a call and we will be able to assist you.